Good morning, everyone. Thanks for joining Munson Healthcare's COVID-19 press conference. Today is Tuesday, December 14th, 2021. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Joining me today will be Dr. Joe Santangelo, who's the Chief Quality and Safety Officer for Munson Healthcare. And if you joined us last week, I did misspeak. I said that the health department partners would be back in 2 weeks, but I was wrong. We are excited to have the representatives from our local health departments back today. And those representatives include Wendy Hirschenberger, who's the health officer of Grand Traverse County Health Department, Lisa Peacock, who's the health officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan, and Dr. Jennifer Morse, who is the medical director of District Health Department number 10. So today we will get started with an overview of the nation and Michigan case numbers, and that will be given by Dr. Joe Santangelo, our Chief Quality and Safety Officer. Welcome, Dr. Santangelo.
Thanks very much. Thanks for having me. So we review this graph most weeks, and you'll notice that we continue to have a significant number of cases across the northern part of our country, kind of in this band across the northern part of the country. And this seems to be mostly related to just us all being indoors since the weather got so much colder. Of course, we know that this virus is most easily spread when you're unmasked and in close quarters or areas with poor ventilation. So when we were all sitting around a campfire, it was a lot harder to catch COVID. And now that we're all inside with the colder weather, you really see that increase now in our area, whereas in the summer we saw that across the southern states. So it's not just Michigan, it's all across the northern United States, but we continue to be in a hot spot as far as COVID-19 activity. Next slide. So we continue to have very high percent positivity and inpatient numbers. And if you were watching last week, you'll notice that this is a lower percent positive and a lower inpatient number than last week. We're really glad about that. I'm not sure it makes a trend yet. We do see variations. Some days we have a few more or a few less patients. We have 119 patients right now. We did hit a peak of 146 earlier in this surge, but that 119 is still significantly higher than we were in our other surges. So back in the spring surge that we saw, we were really busy and we're very concerned with 99 patients. And so 119 is better than 146, but it's not a place where we feel comfortable. And again, with that positivity rate in our initial surge back in last fall of 2020, we hit almost 12% and we thought that was high. We've been above 20% for some time now. We're back below 20% for today, which is great. But again, a little nervous about saying that things are on the mend with just a couple of days of good numbers. So we'll take it. I'm glad that they're heading in the right direction, but it doesn't really make a trend yet. Next slide. This graph shows the patients who are currently hospitalized across northern Michigan in a Munson Healthcare facility. And you'll notice that of the 119 hospitalized patients, 99 of those are unvaccinated. Of the 43 patients in intensive care units across the Munson Healthcare system, 39 are unvaccinated. And of the 16 patients on ventilators, all are unvaccinated. So this graphic really kind of tells us that the patients who are hospitalized for COVID-19 who are vaccinated are fewer and they do better. They get less critically ill than the patients who are unvaccinated and get hospitalized for COVID-19. So this is really striking when we see it in this kind of graphic to really see that the immunized patients, while we do see some breakthrough cases, those are patients who are fully immunized but get COVID anyways and need to be hospitalized. We do see some of those, but it's a very small percentage of the overall COVID-19 inpatients across the Munson Healthcare system. Next slide. This is data from the Michigan Department of Health and Human Services, and these trends sort of mimic those two big surges that we saw in last fall and then in the spring, and then you'll see our current surge right now. And it's a really busy graph, but it shows all those different ages. So each one of those colored lines is a different age group. And you'll see that at the top of the graph now in that gray bar on the kind of the far right on the top of the graph, those are 30 to 39-year-olds. And that's who across the state of Michigan, are most likely to be infected with COVID-19 right now. And if you look at the bars at the very bottom in that gray area on the far right of your slide, those two kind of darker colored orangish red bars, those are patients who are 70 to 79 and over 80. And those patients have a much lower rate of getting infected with COVID-19 right now. And we think that likely some of that is attributable to the fact that that age group over the age of 70 is much more highly vaccinated. So again, a great sign that the vaccine is working. And you'll notice that increase in those younger patients, and we're seeing that in our hospitalizations as well. And then we are seeing a significant increase in younger patients as well compared to earlier in the pandemic and earlier surges. Next slide. So Omicron is of course in the news a lot, and it's hard because we like to give you lots of data, and we don't have a lot of data on Omicron just yet. One of the things that it's important to point out is that we are still testing, the state of Michigan lab is testing samples from all around Michigan looking for the Omicron variant. But that testing, the COVID testing itself to see if you have COVID or not, that testing is really quick. And that testing can be done same day and often very quickly. The testing where they have to look at the genetic makeup of the virus and determine which variant it is takes a lot longer. So sometimes that testing can even take as long as 2 weeks. So we don't have any evidence from the state lab that there is Omicron up in northern Michigan right now. But I think everyone feels comfortable saying it's not if, it's when, and it certainly could be here already, and we just don't know it yet because, again, that testing of which variant it is tends to lag behind. Right now, all the samples that we're sending to the state lab are all coming back Delta. So it's all Delta from the ones that we've tested, but there may be Omicron here, there may not, we're just not sure yet. It is important to note that we're thinking that Omicron is a lot like Delta in that it's very contagious. So Omicron is thought to be a very contagious strain of the COVID-19 virus. It is thought that the vaccines, especially if you get that third booster dose for Pfizer or Moderna, or that second booster dose for Johnson & Johnson, is going to be effective at preventing serious illness or hospitalization or death from COVID-19. So that's really reassuring. And that early data obviously there's a lot more information that's going to come out, but it does look like vaccines, especially if you're boosted, are going to be effective. There are some studies or some initial data that seems to say Omicron might cause a more mild strain of COVID-19, but we just don't have enough information yet, partly because we have to do that testing and figure out which samples really are Omicron. And that's not just across Michigan, that can take some time. That's kind of everywhere. So we have to do that testing and then go back and find those patients and find out how they did over time. We all know that sometimes patients with COVID-19 get worse over weeks. And so you can't know right away whether the Omicron is worse, better, we're just not sure yet. So lots more information to come. But the kinds of measures that we've been taking all along to prevent COVID-19 will also prevent the Omicron variant of COVID-19. So not a lot of changes that we're asking people to do. Keep doing the things that have kept us safe for this long. Next slide. There is, as we all know, the COVID-19 vaccine has been approved. The Pfizer vaccine has been approved for children aged 5 to 11. And that vaccine is being given in lots of places. It is being given through a Munson Healthcare pediatric immunization clinic in Traverse City. There are many pediatricians and primary care offices that are giving this vaccine in their offices across northern Michigan. So do check with your primary care provider, with your child's primary care provider. And then lots of local pharmacies and our health department partners are all giving these vaccines as well. So there's lots of vaccine out there. We know that there have been times where it's a little harder to get than others. There's lots of availability out there, including for younger children. So please do reach out and get those younger kids vaccinated. Next slide. Worth talking about influenza. So influenza is not, we're not seeing a ton of it up here in northern Michigan yet. We are starting to see some hints that it's creeping north, as it usually does. That big bar that you see on this graph is likely related to those outbreaks we heard about earlier downstate in some college settings. And you see that kind of returned back to a more normal number. We've seen a couple of influenza hospitalizations literally a couple, like two, across northern Michigan within Munson Healthcare over the last several weeks. But we're not seeing lots of influenza activity yet, which is great because normally we see significant influenza activity, which leads to lots of hospitalizations, and our hospitals are already busy with the COVID-19 surge that we're experiencing. So glad to say not a lot of influenza yet, although it does look like it might be headed our way. Next slide. One of the most important things that we all can do to keep each other safe is to get tested if you have symptoms of COVID-19. There are lots of patients who don't get tested because they think it might be something else. Well, I thought my throat was just scratchy because of the change in weather, or thought maybe it was some indoor allergies. We hear this all the time. And if you don't know if you have COVID-19, then it's much easier to spread to other people. So if you have symptoms, please get a test. Many of our local health department partners are continuing to offer some testing. Primary care providers are often have testing in their offices. There also is testing through some pharmacies. And the michigan.gov/coronavirus does have a really nice web finder of finding places that you can get tested. So please don't hesitate to reach out and find a test if you're having any symptoms at all. It's really important to know whether you have COVID-19 or not. There's also the hotline that you can see here. And then of course, Munson Healthcare has our Ask a Nurse line, and they have lots of resources for finding a testing site for you. And that Munson Healthcare Ask a Nurse line, 231-935-0951. You don't have to be a patient of Munson Healthcare to call that line. So please use that resource as well. Next slide. So this is a time when working in healthcare has been a little bit interesting over the last 2 years. Right now, our healthcare team is feeling stressed, and we had tons of community support early on in the pandemic. We really appreciate everyone who's continuing to offer support to our healthcare teams across northern Michigan, our health department teams and our Munson Healthcare teams, our primary care offices and specialty offices. One of the most important things you can do to show support for your healthcare colleagues and for the healthcare team is to help to slow the spread of COVID-19. So get vaccinated. If you've been vaccinated but you haven't had a booster yet, please get a booster. It really seems to make a difference against both Delta and likely against Omicron. If you're in an indoor setting, we still have very high levels of transmission across our areas. And so if you're in an indoor setting, please wear a mask. If you're in a room by yourself, I'm in an office by myself with a closed door, you don't have to have a mask on then, but if you're around other people in an indoor setting, please wear a mask. Not only does that help to prevent the spread of COVID-19, but it helps to protect you and each other against lots of other illnesses too, even just common colds and influenza, RSV, lots of other illnesses. Practice social distancing. We know that this virus, it's much easier to spread when you're really close together. And then wash your hands. That's great for all kinds of reasons. And so just keep your hands washed. Just as a general rule, a good idea kind of at all times. As a pediatrician, it's important to get your kids to learn to wash their hands early and often. Next slide.
I think that's it, Dr. Santangelo. Thank you so much for that update. It is good to see that the hospitalization numbers are a little bit lower this week, but we'll have you back shortly after the health department report outs to answer a few questions about what you just presented. So thanks again, Dr. Santangelo.
Thank you.
Next, I'd like to welcome back Wendy Hirschenberger, who's the health officer for Grand Traverse County Health Department. Welcome back, Wendy.
Thank you. All right, we'll hop into some trends and numbers that are happening in Grand Traverse County right now. Similar to what Dr. Santangelo talked about with hospital numbers, we do remain with high transmission rates. They're not the highest they've been, but we're still at quite a bit higher than we were in earlier fall or the summer. So this last week, we had 338 newly identified cases and 6 deaths. That was just within the last week. We're averaging 48 cases per day right now. We were up as high in the 80s for a period of time. And then I think for the month of November, we averaged around 65. So it is starting to come down, although it's more of a 1 week trend right now. So we do want to see that continue. Our current region's percent positivity is 16.2%, which is also down, and Grand Traverse County is at 15.8%, which is down from about 20% in previous weeks. And then you can see our cumulative total number of cases and deaths. So we've had 161 deaths throughout the entire pandemic of just Grand Traverse County residents. One thing I should mention is that we've had the highest number of deaths that we've seen throughout the pandemic in the last month, and that typically what happens with deaths is that they lag behind new cases identified anywhere from 2 to 8 weeks after the onset of their initial COVID symptoms. So that's why you tend to see some death is called a lagging indicator. So it kind of lags behind as far as when it peaks as well. Next slide, please. And then here's our vaccination rates for Grand Traverse County. So we're at 72.7% for all age groups having 1 dose and 66.5% for completed. This particular chart doesn't speak to boosters, but you can see it broken out by age group. And when Dr. Santangelo talked about some of the groups that were hospitalized, you can see that when you look at anything under that sort of 40-year age range, we have work to do as far as the vaccination rates. Those are kind of the lower numbers, and you see in the 65+ age group that we're exceeding 94–95%. So that probably is kind of confirms some of the messages Dr. Santangelo was talking about, that older age group not being hospitalized. Next slide, please. So vaccine availability at our clinics in Grand Traverse County, we essentially have 2 clinics that we run. So one is for the ages 5 to 11. Those are by appointment at the main health department building on the Franier. For the next 2 weeks, we do have appointments. Dose 1s will be available. We'll release appointments this Wednesday at 10 a.m. That's when we're tending to release appointments on a weekly basis. And so you can see here, this is our projected schedule for vaccinations. For Monday and Tuesday, we'll have first doses, and then Wednesday we'll have previously scheduled second doses. And then the following week, we will focus on just some existing scheduled dose 2s, just because we'll be a little bit lighter on staff that week. Next slide, please. And then this is just a reminder that CDC did approve anyone over the age of 16 can get a booster. So specifically for the 16 and 17-year-olds, they can get a Pfizer booster, and anyone 18 and older should get a booster. And depending on what you received as your initial booster, you can continue on with that series, or you can choose to cross over into another maker of vaccine. And we have people doing it all of those ways. Next slide, please. And then this is just information on our primary vaccination clinic, which is at the Cherryland Center. And we also release those appointments via a separate scheduling link, Wednesdays at 10 a.m. For the next 2 weeks. This Sunday, we'll be doing a vaccination clinic as we did last Sunday. And then on Tuesdays and Wednesdays, there's some holidays in there. So we are vaccinating 3 days. On occasion, we can add days in, and we usually post that on our Facebook too, or you'll see it when you go into schedule. So keep checking the link for new times weekly. And then just also a note, since there's more testing happening at home, just if you do have a positive, we would like it if you would submit your results here, and then you'll receive some follow-up communication from us as well. Next slide, please. And then Dr. Santangelo talked about seasonal flu. So we also offer flu shots at the health department. Pretty much we take anything as far as payment or insurance. And as far as the coverage throughout the state, we're at 41.2% and Michigan is at 26.3%. We're definitely lagging behind a typical year as far as vaccination rates. Thank you.
Thanks, Wendy. Appreciate the update. A lot of good stuff going on in Grand Traverse County, and I know you guys are really busy, so thanks again for all the hard work. We will have Wendy back for the Q&A session at the end of the presentations, but next it's my pleasure to welcome back Lisa Peacock, who's the health officer of the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. Welcome back, Lisa.
Thank you so much, Diane. Thanks for having me. So Health Department of Northwest Michigan and Benzie-Leelanau District Health Department are experiencing very much the same situation that Wendy has described. Cases and positivity are slightly down from last week in all of my counties, which good. We have our fingers crossed that will turn into a trend that we can watch, but we'll see. Our testing demand is also slightly down, which has been interesting to watch. It is very much dependent on what's going on with cases in the community, but certainly we still want people to get tested. We have availability at our clinics. We still have the HANU management group in several counties and lots of availability. Please visit our websites for any looks at that. But as of right now, we have that testing available, and it's rapid testing and PCR testing on a walk-in basis on Mondays at the E-Free Church in Gaylord, on Thursdays at the Central Lake Fire Department, on Saturdays at the Charlevoix County Shirley Roloff Center. And then in the Benzie-Leelanau District, we have Mondays and Thursdays at the BFW post in Lake Leelanau, and Tuesdays and Fridays at the Crystal Cafe. Through the holidays, the Lake Leelanau site is not available on some certain days because they have some other holiday-related events going on there. So please continue to check our website for the most up-to-date information, or Facebook. Our vaccination rates range from about 16 to 32%, depending on the counties, for our 5 to 11-year-old population, about 42 to 58% for our 12 to 15-year-old population, and about 55 to 66% for our older teens, 16 to 19-year-olds. So we would like to see those numbers get up a little bit higher. And I, agree with Wendy completely. There's lots of opportunity to get vaccinated, as well as people being able to get their boosters now. So I won't go into the details about the boosters, other than to say we are certainly, making sure that we're making those available to everyone. We are seeing outbreaks related to employers much of the time. And so one message we want the public to remember is that, for businesses to stay healthy and open, it's really important that they follow the OSHA guidance. There aren't requirements for many types of businesses right now outside of healthcare for mitigation measures, but they are still very much recommended. And when we see outbreaks related to businesses, they're often coworkers who are working in close proximity to each other, often not masked, and often not vaccinated. And so we're here to support those businesses in their efforts to stay open and healthy through the holidays. One sick employee can result in several other employees being out due to quarantine. And so, we continue to address that in our messaging, but we just want to remind everyone that, especially at this time of year, as Dr. Santangelo said, that we're spending a lot of time indoors. Masking is a really important protective measure that's been proven over and over again to work well. And vaccination opportunities are widely available. And if people are experiencing any symptoms, even if they're mild, or they potentially have had an exposure, been around a lot of people indoors or anything like that, please seek one of the widely available testing opportunities. I think that's all I have for today, and I'm happy to be available for any questions and answers.
Great. Thank you so much, Lisa. Thank you for all the hard work you and your teams are doing as we continue through this pandemic. We really appreciate it.
Thank you.
Next, I'd like to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thanks so much. Like everyone else has mentioned, we have had similar, cross our fingers, promising numbers. Our case rates have continued to go down slightly. Our percent positivity has also gone down slightly, although we continue to be quite a bit higher than the state percent positivity. And still, again, our case rates are a lot higher than we'd like to see them, but hopefully we're seeing a promising trend. Next slide. So as Lisa was mentioning, we have done a lot of work to try to increase access to testing as well. Right now we have regular 3-day-a-week testing access in Big Rapids, Cadillac, Kalkaska, Newaygo, as well as Grayling at the Kirtland Community College. It's not listed on there. And also soon we'll have availability in Ludington and Oceana. The testing has been actually utilized quite well, and we're seeing quite high positivity rates at those centers. Again, those offer rapid antigen testing and PCR testing to those who it is indicated in. So our busiest one right now is in Nuevo County at the NC RISA, and often it's lined up quite a bit. So we ask people to watch signs, because it has been a bit of a traffic hazard at times. But at that site, it's been close to 29% positivity, and our other sites have been between 19 to 29% positivity. So again, those are available, and we really encourage people to utilize those. If you go to our dhd10.org/events site, there is a calendar there. You can find all of our testing events, as well as our vaccination clinics that are in the public, and flu events as well. And you can schedule those online. So I'd really encourage people to utilize those. Again, as Lisa mentioned, there are some schedule changes over the holidays, but they are still available. So next slide. This slide we've been showing each time we've been on this call now for a little while. Again, it only shows vaccination rates from the 16+ age group, just because of limitations of this resource. But we do continue to see a few new initiations of vaccinations each week. We are seeing pretty good demand and individuals presenting to get their booster doses, so that is good. So again, we still have those pockets within our areas where we do continue to have quite low vaccination rates, and that really puts those communities at risk for outbreaks and higher rates of COVID infections. So next slide. So our 5 through 11-year-old age group, about 10% have initiated it. We have really started to slow down dramatically in the uptake of that vaccine. And so we really do encourage parents, if you're thinking about doing that for your children, to not hesitate, especially as the holiday season comes up, to at least try to get that vaccination series initiated, or if your child is due for their second dose, to try to get that as soon as possible. Because with family gatherings and things, as much immunity as you can get to your young children, the better. We also have a reporting button on our homepage, just like Grand Traverse does. So if you have done home testing, you can report that there. Again, we have our other websites available for information, scheduling, and information on events. I think that is all that I have for today.
Thank you so much, Dr. Morris. Again, thank you to you and your teams for everything you're doing as well. Now I'd like to invite all of our panelists to turn their cameras back on and join us for our Q&A session. If you are a reporter joining us through the Zoom technology, you can use the Q&A feature to ask your question, or if you're joining us live on Facebook, please feel free to submit your question and we'll get to as many as our time allows today. So first question, I'm first going to ask Dr. Santangelo to comment on this, and then I'd like the local health department representatives to also comment on this. Dr. Santangelo, we see that the hospitalization rate is slightly lower this week. Are we also seeing the same amount, an increase or a decrease in deaths across those who are hospitalized?
Yeah, it's a great question. We have seen more deaths recently than we did earlier in the pandemic and with earlier surges. I think we're having pretty much daily deaths across the Munson Healthcare system every day for the last several weeks. Over this past weekend, we had 10 deaths within the Munson Healthcare system just over the weekend. The deaths tend to lag behind people who get COVID-19 and the progression. If somebody's going to die from COVID-19, usually people get it, then they get sicker, then they get hospitalized, they get sicker and they go to an intensive care unit, and then they get sicker and then they die. So it takes some time for that process to happen. And so sometimes what happens is we see the hospitalizations start to go down, but the deaths don't go down yet, and because they kind of lag behind. And then, Dr. Morse just reminded us earlier that not all deaths occur in the hospital either. And so sometimes hospitalizations and deaths really are separate topics. So we are still seeing patients die from COVID-19. And so I'm really glad those hospitalization numbers are down, but we're not out of the woods yet.
Thanks, Dr. Santangelo. Next, I'd like to ask Wendy to comment on the same topic. Wendy, are you seeing You mentioned increased or deaths or a high number of deaths recently within the last month. Are you also seeing people who are not hospitalized that are also dying?
Yes, so Dr. Santangelo explained exactly what I would have explained about the lag. And as we saw, our highest peak of cases was about anywhere from 2 to 4 weeks ago for at least Grand Traverse County. And during that time, and it's been a continuous high sort of peak. So we have seen consistent number of deaths, but we have had a few weeks where I'm getting notified every single day of deaths. And yes, we have had deaths occur in homes through if it's a home death that there's not hospice present, then a medical examiner's office would then investigate those deaths as well.
Okay. Thanks, Wendy. And Lisa, do you want to comment on your jurisdictions?
Sure, very consistent with the rest. We're definitely seeing a rise in deaths and a rise in deaths of people at home who were never in the hospital or discharged from the hospital. We had 7 deaths last week, and that's pretty consistent in the Northwest District, about a death a day on average being reported to us. And we went from 2 deaths 2 weeks ago to 5 deaths last week in the Benzie-Leelanau district. Benzie-Leelanau saw a little bit later surge in cases than Northwest. So I agree, it very much kind of consistently follows that pattern. And I know that our medical examiner partners are seeking more testing resources and things like that so that they can properly, do what they need to do in the field, because they are encountering these deaths at home more often, and definitely skewing younger, and some very tragic stories. So, we're definitely concerned about that, but hopeful as cases go down and hospitalizations go down, that deaths will follow.
Thanks, Lisa. Dr. Morse, any final comments on that topic?
No, pretty much the same. As a caveat, I mean, I cover 20 counties over a large area, so not just in the Munson area. And seeing the same thing, seeing people that never do go in to get diagnosed and get care, just are sick and stay home and die at home and are diagnosed by the medical examiner, or are diagnosed and just get worse and may or may not call for medical advice from a provider and just end up dying at home because they don't go back in for care. So I think, one word of advice is if you're sick and get worse, go in, even if ERs are busy, going for care, know that there are treatments available. And if your provider is not mentioning to them, research them on your own, look up monoclonal antibodies. If you're sick, if you're not thinking it's COVID, make sure to think about COVID, because we've had people too that feel sick one day and die in their sleep that same night. So it's just hard to know. So
it's tragic. Thanks, Dr. Morris. That's a good reminder. That's actually also a good segue into our next question. Dr. Santangelo, can you tell me anything about availability of monoclonal antibodies and whether supply and ability to administer the therapy is matching the demand for them?
Yeah, it's a great question. So Munson Healthcare has been providing monoclonal antibodies for some time now as a treatment. We're now offering it at all of our facilities, and in sometimes multiple locations within the facilities. We might have folks who are getting monoclonal antibody therapy in an emergency department, but also as outpatients where they come to the hospital and get it as an injection or an infusion. We're matching demand, so we have enough monoclonal antibody supply, and we right now have enough people to deliver that therapy. So we feel really confident that we're able to match the demand. There have been supply chain problems with monoclonal antibody therapy. So far, we continue to work with the state. They've been great to work with, and we've been getting our allocation of monoclonal antibody therapy. So supply has not been an issue for us, and staffing wise, we're at a point where we're able to provide it to all of the patients who need it.
Great, thank you, Dr. Santangelo. Next, I'm going to ask Wendy to comment on this. Is it okay to mix your booster shot? So if you, for example, had Pfizer the first time, and can you go and get a different type of booster now?
The short answer is yes, you can. It is the choice of the individual at this point. There's various, tools out there if people want to research it. Some people are just choosing to stay with what they started with, and other people are switching over. But if The booster chart that I shared earlier just basically explains it's, and it's on CDC's website also, that you can mix.
Thanks, Wendy. This next question is for Lisa. It's also related to boosters. Do we expect a recommendation at any time to be made for ages 12 to 17 to receive a booster? Have you heard anything about that?
You know, other than general discussion that that data comes later than the data, the most recently eligible groups are currently continuing to be evaluated. And as long as that time goes by in the same way and they monitor what happens with immunity after a certain period of time, then I would expect that we might see the very same thing. But I don't have any details beyond that at this point. Great,
Thanks, Lisa. Next question is for Dr. Morse. They say that they may make an Omicron vaccine. So actually before the booster, should we wait to get that, or should we get the booster now?
So they said something similar with the other variants, you know, that with the mRNA technology, it is quite simple. And with the adenovirus technology, it's pretty simple to kind of plug in a new program. We really have to wait and see if the current vaccines cover it well enough. And from everything I have read to date, the mutations in the Omicron variant don't appear to be such, even though there's quite a few, the current vaccines should work well enough. So I would not delay on getting your booster at all. I would get it. And if for some reason later evidence shows that we do need to change, even if we do need to change and they can do it quite simply, it will still take many months to make that change and to produce a new vaccine. So do not wait. And again, even though there may be some speculation, I have a feeling it'll come out that they're not going to need to make a new vaccine.
Great. Thank you, Dr. Morris. That's really good information. This next question, I'd like all of our health department representatives to comment on, starting with Wendy. You know, we just talked briefly about the number of hospitalizations and the high percentage of hospitalization rates with unvaccinated individuals. Are you seeing more deaths in counties that have lower vaccination rates? Let's start with Wendy.
Well, this one's a little bit hard for me to answer because I only cover one county. So,
Okay.
And we have a fairly good vaccination rate. So I don't have anything to compare it to.
That's true, Wendy. I didn't even think about that when I started with you. So let's move to Lisa.
Yeah, you know, what I would say to that is that we have over time certainly seen more cases and outbreaks in counties where we have lower vaccination rates. Hospitalizations and deaths county by county are very hard to compare. The numbers are small. There could be a lot of different factors influencing those things. So I can't really speak to that particular comparison, but certainly we have seen increased cases, increased positivity in our counties where we have lower vaccination rates.
Thanks, Lisa. And Dr. Morse, are you seeing the same thing?
Unmute. It has been tricky again because our populations are small. I did find a nice map on the New York Times data site where it shows per capita how many people have died from COVID. And in some of the counties that I cover that are rural and have lower vaccination rates, the death rate from COVID has been 1 out of about 250 people. So out of every 250 people in that county, 1 has died of COVID. So to me, that's a lot.
Wow.
On average, most of the counties are about 1 in 400, which again, to me is still just an unacceptably high number. But again, as you kind of scroll over different counties, there are some counties that do have a pretty low vaccination rate that may have a lower death rate. And it is, without really going into statistical dive and really breaking it down like that map I showed where it's per zip code, I think it would be hard to make a generalization. But my hunch is if I was a really smart epidemiologist, I could probably do that. It's just when you're looking at a whole county with a population of 30,000, it is really difficult to do that. But it is heart-wrenching to see that and it's the county I live in, that 1 out of 250 people have died from COVID in the last 2 years. So.
Well said, Dr. Morse. Thank you. This next question is for Dr. Santangelo. The number of Munson patients on ventilators has almost doubled from last week. So last week we reported 9 and today you reported 16. Even with a drop in overall patients from last week, is the hospital seeing an increase in more severe outcomes?
Yeah, I think yes, we are seeing patients get really sick with COVID-19, and some of the patients, sort of that progression of illness. So you get sick and then hopefully patients get better, and we do lots of medical treatments for patients when they're in the hospital to try to get them better. But if patients are going to get sicker, it takes some time, and they get sicker and then eventually get moved to a critical care unit and then sometimes need to be put on a ventilator. So I think the increase that we're seeing now is just sort of that progression of disease from the patients who've been in the hospital. Most patients don't come into the hospital and go on a ventilator the same day. It's usually kind of a progression of illness. So I think that's what we're seeing. We are seeing a lot of critically ill patients with COVID, and our critical care units do have lots of COVID patients in them.
Thank you. And I do have 2 more questions for you, Dr. Santangelo. We have had some of our infectious disease experts on in the past that have answered this question. Is there a better idea at this point whether or not the COVID booster will become an annual vaccine like the flu shot? And I know I've had Dr. Ledke on in the past, and he had commented at that time, which was probably over a month ago, that he wasn't expecting that the COVID vaccine would be an annual thing. It's right now, it's just coming in surges. What do you know today?
I think I know about as much as everyone else.
You have your magic 8 ball?
I have one, but it hasn't been very helpful lately. No, we just don't know. I mean, I think we didn't know when our spring surge ended this year. So when it was April and May, we had no idea we were going to be where we are right now. So I think trying to make a guess about what's going to happen in a year, I just don't have any idea. I'm really glad that we have the vaccines. I think if the disease stays like this and it stays significant, then we probably would recommend it every year. If this becomes more episodic and kind of burns out, it wouldn't. And boy, wouldn't we all like to know what the future brings there. So I'm sorry to say I don't have a great answer for that question.
It's okay. We'll keep asking it though, and we'll continue to learn more as we get more data as well. Dr. Santangelo, how is the prolonged surge impacting Munson hospitals? Have you made any changes as a result of the continued high numbers of COVID-19 patients?
Yeah, we've made a lot of changes because what we really are trying to do is to balance caring for the COVID-19 patients, some of whom are really, really sick and take a lot of resources, a lot of staff and ventilators, and still taking care of people who have non-COVID illnesses. And so, if you right now have an appendicitis, or you're worried that you're having a stroke, we want you to come to the ER so that we can care for you. And so we really need to preserve that capacity. And that means that we're doing less of some other things, whether it's administrative work that we're trying to pause. We have slowed down on elective surgeries, as many people know, because we need those resources to take care of patients who are sick in the hospital or patients who are coming to our emergency departments. So I think we've made a lot of changes to try to adapt so that we can still care for people when they need us for non-COVID reasons, but can also care for people when they have COVID. And I think it's probably just worth noting that just like everywhere else, there are significant, just really staffing challenges, and we really appreciate all the support of our community towards our staff. It really does mean a lot. Our frontline staff workers are working really hard, and the reason that we all come to work in healthcare is because we make a difference in people's lives. And when people show up at a hospital, you don't go to the hospital for fun. So when people show up at the hospital, they're often in the worst spot of their life sometimes, and being able to help people when they're in that situation is really rewarding. And so having the support of the community to help us do that in a safe and high quality way is really, really important. So lots of changes that we've made to deal with COVID-19 and this prolonged surge, and we're glad to be here to care for people.
Well said, Dr. Santangelo. And I do just want to mention that we do have an area on our website that if you'd like to send a message of support to a healthcare worker, you can submit it on our website, and we would be thrilled to share those with our teams.
We could probably share those if you want to submit one for the health departments, we'll share them with our health department.
Absolutely. Any healthcare worker. Absolutely. One last question, and then we're unfortunately going to be out of time. But Dr. Santangelo, are there any other treatments for COVID-19 coming down the line. We've heard recently in the news about a potential a pill from Pfizer. Have you heard of anything else, and when would we possibly expect something new?
Yeah, it's a great question. We are seeing continued kind of new treatments coming out. There's a new kind of monoclonal antibody therapy that is going to be offered soon that we're really excited about. It's for a very small subset of patients, but for those patients who are immunosuppressed. So we're hopeful that we may be able to offer that. That's not quite here yet. It's not quite ready, but should be soon. We're very excited about the concept of an oral medication that could keep you from getting sicker just with a pill that you could take at home. We were really excited about that. The data has sort of been a little bit up and down. And so we really want to be sure we have a really good understanding of not only safety, but also how effective these treatments are. I think the other thing we heard from Pfizer is that there are some production issues. And so I think we're talking certainly after the new year and maybe even closer to spring for that oral therapy. But things change. There's lots of great scientists working on lots of different things for this. So I'm still optimistic that we'll continue to develop more treatments. I don't see anything coming in the next few weeks that's going to be dramatically change the way that we're caring for COVID-19, but we'll keep you informed. Stay tuned.
Agree, Dr. Santangelo. We will host a separate press conference on that if something new is released. So you'll be the first to know. Well, we are out of time. I do want to get to a couple of closing slides, but I do want to first thank Dr. Santangelo, Wendy Hirschenberger, Lisa Peacock, and Dr. Morse for joining us. It's always great to get the different perspectives from across Northern Michigan. So again, thank you for taking time out of your busy schedules to join us today. And lastly, I always just like to end on our community resource slide. Some things that weren't mentioned in the health department and in the Munson Healthcare updates were things like the 211 hotline that you can call, or the area Agency on Aging of Northwest Michigan. Great resources. So please look to Munson Healthcare, look to your local health departments, and use the 211 and the area Agency on Aging of Northwest Michigan. Next slide, please. And as always, I invite you to sign up for our e-newsletter, follow us on social media, and visit munsonhealthcare.org for the latest updates. Our Ask a Nurse hotline has been very busy lately, so we're excited to continue to offer that service. If you have a COVID-19 question, whether it's around the vaccine or a booster, or you just have a general health question and you're not sure whether or not you should be seen by a provider, please call 231-935-0951, and we'll be happy to answer your questions. Once again, thank you all for joining us. I do want to give a shout out to all of our marketing and communications team behind the scenes that help us produce these press conferences. They do a great job, and it's a lot of work, but we are committed to continuing to do this as a service, not only to our reporters, but to our community. So thank you for your support and for watching today, and stay safe, and we'll see you again next week.